Well, some of the reasons stem from just not having access to the right type of information. It could be they heard an anecdote on, social media. Their cousin's baby's mama's friend had, told them about something. But a lot of these, a lot of these things stem from things that are just, frankly, not true.
To be fair, though, there have been some challenges throughout this pandemic. I mean, first it involved masks, and then the Johnson & Johnson vaccine caused quite a bit of a stir. So, if you are sitting out there and wondering, is this the right move for me? How do you navigate those feelings?
Well, first, think it's important to point out that the American public right now is seeing the scientific process in action. You're getting a view underneath the hood. And as scientists, when we're trying to do things, we're actively trying to disprove our hypothesis, right? We have an idea of what will happen. And we say, well, let me do experiments to prove or disprove that hypothesis so that we know that moving forward, that we are correct under a vast set of conditions. With the Johnson & Johnson, when that got taken off, that actually proves that the system does work instead of us saying, well, let's just leave this on the market. It might hurt people, screw them. No, we don't say that. We say, well, let's actually make sure that this is true, this is verified, this is safe for people to take. The thing with masks is like, well, we didn't actually have great data on how masks do protect people. So we had to do all those studies on the fly to actually figure out, well, respiratory droplets would get caught in the mask. So again, you're seeing the scientific process in action.
Much of the concern from people who are skeptical surrounded that this vaccine came to market much too quickly. This is what you study. What do you say to them?
Well, what I can tell you is that the safety period of study for this particular vaccine did not change from any other vaccine. What ends up happening is when you're trying to get something to market, there's a lot of market analysis. Will the community need this vaccine? Will the community need this drug? There's also a lot of manufacturing that you have to do, which you don't do until you do that market research. Otherwise, you would lose out on all the money that you poured into something if somebody actually doesn't need that. What happened in making these particular COVID vaccines is actually those processes started to overlap. So the safety data was actually done at the same time as manufacturing, and the market research wasn't necessarily needed because it was pretty obvious. And a lot of those processes were also supported by the government so that they could actually be accelerated. Actually Project Warp Speed. But again, the safety period, the study period, that actually did not change. It's just that everything was overlapping, and that's what sped up the whole process.
For the families who are watching this and hearing the news that children could be vaccinated here very quickly, what do you recommend to them about the best research for their family as, they debate whether or not they should do this?
Well, I think that it's important for you to make sure that your sources are real. And by that, I mean, if you see a meme on Facebook, if you see a meme on other social media, uh, those are sources that anyone can really make up at any particular time. However, if you see verified research on CDC's website, NIH's website, these are sources that you can actually trust. And it's weird to say, I guess the counter argument if people will say, well, you have an agenda, you make money from giving those like I don't make any money from these vaccines. My only agenda is to actually be able to go back to normal. And the only way we're going to be able to do that is for people to be able to get vaccinated.
You believe there's been a real need for communicating the science in layman's terms, but then doing so that it reaches a wide audience.
Absolutely. Communication has been key. So if you look at data in October, about 40% of African Americans said that they would get the vaccine if available. Counter that to March, all of a sudden that percentage is in the 70s as far as who would get vaccinated or have already been vaccinated among the African American community. That was due to educating those particular populations, going into churches, going into schools, talking to community leaders. So the education for this virus and for getting the vaccine actually does work, but it just takes a lot of people to do that.
Okay. Dr. Michael Johnson, thank you.
Thank you very much.